back. The World Health Organization says there's an urgent need to transform mental health care. In 2019, nearly 1 billion people were living with a mental disorder. Suicide accounted for more than 1 in every 100 deaths, and 58% of suicides occurred in those younger than 50. Mental disorders are also a leading cause of disability. Today, the WHO released its largest review of world mental health since the year 2000. Global Mental Health Peer Network founder and CEO Charlene Sunkel joins me now to discuss these findings. Charlene, thank you so much for speaking to us this evening. Now, you have personal lived experience of accessing mental health care at both public and private facilities. Why has it been so important for the WHO to take these lived experiences from individuals and academics and those in the field into consideration when deciding on what needs to change and how it needs to change?
Thank you very much. Yes, this report is indeed a landmark moment. The first report in 20 years, but I suppose the recommendations still stay very much as relevant as back then. But from a lived experience perspective, we don't see it often, but it's kind of gaining momentum. Like we with people with mental health conditions, we have experience navigating mental health systems, trying to access care, not trying to thrive with our mental health conditions and not just survive. We've come across the obstacles, we've dealt with stigma and discrimination as, common barriers. We've dealt with human rights violations within and without the system. So for us having this practical and unique perspective, we are able to offer solutions that could be cost effective, but also beneficial and could provide a greater reach of people to access mental health care.
Now, the World Health Organization represents many countries across many socio-economic dynamics. South Africa has its own unique context and problems, especially when it comes to infrastructure. What for you was the biggest finding to come out of this report that has specific bearing on mental health in South Africa?
I think the biggest emphasis of the report is on community-based services. I think it's more cost effective. There's a lot of, you'll see in the report, there's a lot of best practice models and evidence that shows that mental health care can be provided within the community with a long-term benefit of cost savings. If you look at the health budget, a fraction of the health budget actually goes to mental health. And then a large amount of that goes to specialized psychiatric hospitals, which cost a lot of money. So you can think that being able to access mental health care within your community, close to where you live, more appropriate services where you can be supported by family and just, it also talks about task shifting. As we know, there's very few psychiatrists, especially if you look in low and middle income countries, in comparison to the amount of people needing care. Same goes to other mental health professionals. So the report also talks a lot about people, basically in the community, and especially in the report you'll also see there's a big focus on people with mental health conditions, lived experience, who can provide mental health services in terms of peer support work. That has been more situation in high-income countries where peer support workers have been integrated within the mental health system as part of the mental health workforce. Unfortunately, in low and middle-income countries, especially South Africa, that's not happening yet. It has multiple benefits and cost savings.
So this report also makes suggestions for change, shifting attitudes, and there's 3 pathways, and the one that I want to talk about is, it says we need to reshape environments that influence mental health, and that includes people's homes, communities, schools, their workplaces, healthcare services, and natural environments. And that's a huge and very daunting task in a country where we have such a huge divide between the haves and the have-nots, where for many their environment and their lived reality is very much on the breadline and with less than the basics. Do you think South Africa has what it takes to meet the targets set in this action plan? Because essentially this review requires all members of the WHO to commit to aiming to reach these targets by 2030. Can we do it? Is it achievable?
Well, in my view, definitely. I think most important, involve all stakeholders and mostly people with lived experience as your key stakeholders. I think it's kind of, I think we had this wrong perspective, before, like kind of looking at mental health merely as people who live with mental health conditions or have diagnosis. We need to recognize that mental health, for example, I live with a mental health condition. It doesn't mean I cannot have mental health or I cannot have mental well-being. So if we look at it from that perspective, so what does it take for me to have mental health and mental well-being? It means that, all areas of my life need to be addressed. For example, workplace, like you mentioned, workplace mental health. Those who go to universities and schools, mental health needs to be integrated across all sectors. And that, I think, is fundamental. Because what is the definition of mental health? The definition of mental health means that you are able to realize your abilities, but also to kind of thrive, to be able to cope with daily stresses, all those aspects. So if we can address it at all a multi-sectoral aspect, I think we can eliminate a lot of the other problems, from poverty, stigma and discrimination, and also when you have services within the community and cross all sectors, you also look at building a system that is actually within a human rights framework.
Well, thank you so much. That's Charlene Sunkel, Global Mental Health Peer Network founder and CEO. And very fortunately here in South Africa, we have excellent community health services based on our response to HIV and TB treatment. So hopefully that'll stand us in good stead in trying to meet these WHO mental health targets come 2030.